8:30 right now as we take a look at the White House. Looks pretty good. Flags still flying up there. Temperatures in the upper 30s. Let's head over to Studio B right now. Check in with Sarah with our Health Watch this morning. Hi, Sarah.
Hey, Steve. Do you have that knot in your back or your shoulder that just will not let up? A massage won't work for it either. Physical therapists are turning to something, in case you haven't heard of it, it is called dry needling. Chris Estefanos is a physical therapist at Set Sports Physical Therapy in Washington, D.C. Good morning.
Good morning. How's it going, sir?
And great. And you also have with you today Ashley Baker, one of the physical therapists as well. You're going to get the needle.
That's right.
But don't be scared. It's not that bad. So tell me, what is this? You think about putting a needle in to release muscle tension. It doesn't seem like that would work, but it does.
So actually, what we found in Washington, D.C., a lot of people are coming in with tons of knots in their shoulder, tons of pain in their shoulder. We take a small, fine filament needle, similar to the needle used by an acupuncturist, but completely different approach. What we do is we insert the needle into the trigger point, and we get a contraction. That contraction is a resetting of the brain's abnormal signal to the muscle.
So this is something that may be genetic. It's just your body's, trained to do that.
Part of it is just the stresses that we put on our body when we're sitting in prolonged positions, 8 hours a day at a desk. Runners that are putting a lot of stress on their limbs, calves, hips, lower back pain. It's all different kinds of things that we put loads on, and this helps reset it.
Okay, so how is it different? And I know a lot of people ask this question. How's it different from like acupuncture or getting what some people call a trigger injection? So
difference between this and a trigger point injection is hence the name dry needle. There's no cortisone or no injection substance in the needle. It's a fine filament needle. About 16 of these can actually fit into a syringe. So the tip is really fine. Difference between acupuncture and this is acupuncture is Eastern medicine, focused on various other things in terms of the field of acupuncture. And this is focused on improving your range of motion, restoring your tissue length, and improving your mobility and function. Okay,
so why don't you go ahead and show us here? I know Ashley is going to lay down here, and it's really pretty quick too. How long does it take?
It takes, it depends on how many muscles we're treating. But for Ashley, what I'm going to do for demonstration purposes is I'm just going to treat her upper trap, and this tends to be a muscle that is often really, really tense on people. I don't know if tons of people that work, desk jobs have this sort of thing. So what we do is we'll click, we'll pick up the muscle, we'll find where the trigger point is. So typically we'll find a trigger point right in this area.
Trigger point means like a muscle that's just
a knot. A muscle that is really tense, and you see that twitch right there?
Oh, interesting. Okay. Yeah, just a little bit. I'm able to see. It may be difficult to see on camera.
And what we could do also is we keep that localized. Ashley, would you grab this for me? And what we're going to do is we can actually stimulate the needle to cause it to contract. You see how she's contracting all through there?
Now, what is this doing right now?
What this is doing is sending an electrical response through the needle into the muscle, basically causing that muscle to twitch and to reset.
Okay, so it will just relax.
Yes.
How long does this last, the effects of it?
Sit up, Ashley. Yep. The effect, so literally what happens is for 24 hours, sometimes 48 hours, patients will get sore. And what they'll find out is this is not like your typical massage where you feel good today and, symptoms come back later. This is, I feel bad today, and in 2 days I'll feel better.
Okay. Now, I know you do this too at the clinic. Once you do this, are you good to go, or are there other things that you need to follow up with it?
Typically, the most effective use is with other interventions like strengthening and stretching. But being really gentle about it right after the first injection. You can be a little bit sore for about a day, but really the point is to go in and release that muscle to help it to function better. So after that, it's stretching, strengthening, and really trying to restore that normal function.
And again, I think maybe you said this, but how long does it take, or how long does it last, the effects of it? Like how long will it hang around the benefits?
Typically, we wouldn't do it. Sometimes I've had patients that would have an effect between the first session, they feel significant relief. And most of the time, what we need to do is follow it up with stuff like Ashley was saying, that'll restore the proper function of the muscles. So if somebody's like this, if I needle and I reset the muscles, I then have to strengthen the muscles in order to pull the posture back and to improve what people are doing. For a runner, I have to change the way their muscles move and correct their imbalances.
Interesting. So I'm assuming find a certified person to do this.
Correct.
Physical therapists do it.
Physical therapists, chiropractors do it, some physicians do it, and some acupuncturists do it as well.
Okay, and the other thing people want to know probably, is it covered by insurance? How expensive expensive is it?
So typically, it is covered under your insurance benefits. We bill it as a manual therapy code, and there's certain codes that sometimes are used for dry needling. But typically, in the practice, we use a manual therapy code to use it. So it's covered by insurance.
Okay.
Long story short.
Thank you both.
Awesome. Thank you for having us.
Chris Estefanos and Ashley Baker. I appreciate it. Sure. Guys, back to you. Such an easy way, it seems like, just to release all that tension, if you can handle the needle.
Yeah, well,
Steve
that's
just
the key.
did it over here
I
for
just
me.
tried it out on Allison. She feels great.
But he did it with a ballpoint pen, so I don't.
Yeah, that doesn't work the same
Got
way.
a low mark on there.
Okay,
Same
but I
idea.
feel better.
Yep.
So really helpful. Sarah, thank you. All jokes aside. All right.